Welcome to the Heart Rate Variability Podcast. Each week we talk about heart rate variability and how it can be used to improve your overall health and wellness. Please consider the information in this podcast for your informational use and not medical advice. Please see your medical provider to apply any of the strategies outlined in this episode. Heart Rate Variability Podcast is a production of Optimal LLC and Optimal HRV. Check us out at optimalhrv.com. Please enjoy the show. Welcome, friends, to the Heart Rate Variability Podcast. I am back here with good friend of the show, Dr. Ina Khazan. Ina, how are you doing, my friend?
I am pretty well. I am in Denver for the AAPB conference, so very excited to get that, the conference started, and thrilled to be talking to you again.
I know you're like 30 minutes away, but I know you've got like a packed day tomorrow, so I get to see you very soon. But it's hard being this close and not sharing meals with you and hanging out. But I know we'll get plenty of that at the.
We will definitely get to do a lot of that. Yes.
And if you're coming to AAPB, definitely stop by our booth. We would love to see you. So I wanted to record an episode. One, I just always love talking biofeedback with Ina. But we really want to, we've gotten some questions, especially as we've launched the Optimal Zone function to the app. And for those that may not be using our app, hang in there with us, because if you're doing any sort of HRV biofeedback, I think we're going to probably touch on a lot of questions you might have too. So we'll try to make this applicable to everybody. And if you're not doing any HRV biofeedback, you should be. So you should hang on here for some of the benefits. But I thought some of the questions that we've gotten, whether we were talking about the Optimal HRV app, Optimal Zone, and that functionality, we see low frequency. There's just some of these questions rolling in that I thought would be good. I know you and I have talked for hours throughout the years, so I get some of the answers to it, but I thought it would be really good just to kind of talk about the real basics of practicing HRV biofeedback on your own, not with an app sort of system like Optimal HRV. And what are some ways that we can maximize that practice? So, let's start out with maybe the simplest question I've ever asked you on this podcast. Just walk us through the basics. If you were to say, okay, here's how I would like you to sit, to what your posture should be, where should you position the phone? So where am I looking? Just give me the basics of before I hit start and get ready to go. What are some things that you can help to really get us right for a good biofeedback session?
Absolutely. That's it's a simple question, but one we actually don't talk about enough.
Yeah.
And it's a great question. The very short answer to that question is comfortable.
Mm-hmm.
I will expand on that. But I will emphasize that, however you're sitting, do make sure you're comfortable in it. Because if you're sitting someplace, where your shoulder is hurting, your back's not comfortable, that's not going to be a very helpful biofeedback session. But, beyond that, it's a good idea to make sure that you're sitting in a relaxed, sort of uncrossed way. So you're not slouching, even if that feels comfortable. Find yourself a comfortable unslouchy position. You do want to make sure that your diaphragm is free to move, because when you are breathing at resonance frequency, those breaths are going to be a bit deeper than your normal regular breaths. And for that, we do need to allow the diaphragm to move. We need to be able for the ribs to expand with each inhalation, so that the diaphragm moves down, so that we get that air all the way down to the bottom of our lungs. So uncrossed legs, uncrossed arms, non-slouchy but comfortable. I do recommend either sitting or reclining. You can be lying down. I would recommend not completely flat, but just like a little with a little bit of something under your head. So how much you recline is really is really up to you. But if you feel like it's a little bit more difficult to get into that breathing, or it's difficult to get a comfortable breath, then a reclining position may be easier, or like lying down with a pillow under your head may be easier than sitting, because in that position, the diaphragm is going to move a little bit more easily. I don't recommend doing this standing up, at least not when you are first starting out. When you have a lot of practice, people can do resonance frequency breathing, standing, maybe like, standing next to a wall, or with a little bit for support, if standing is for whatever reason more desirable. But for most people, when they're starting out, sitting down or reclining in that kind of open body posture.
Interesting. So let me ask you another. I'll just throw these softballs right over the plate for you. But they're real questions that I think come up here, and for me as well. So as we breathe during a biofeedback practice, I want to talk a little bit about the diaphragm, because I guess where's my lungs in? Because I can inhale and my stomach can go out. I can kind of breathe down to my way low in my abdomen. So walk us through, if you were to coach me on taking the ideal breath for resonance frequency, pretend like I have no idea what I'm doing. How would you help me get in the right breathing method? What should I be thinking about as I engage in my practice?
Okay. Well, I'll start out with telling you what you should not be thinking about. And you should not be thinking about taking a deep breath. I know we've talked quite a bit about that. I'm not going to, dive too much into it, but, very briefly. Oftentimes when we think about resonance frequency breathing, which is quite a bit slower than your typical breathing, many people feel like, oh, that better be a deep breath because it's going to be so slow. But in reality, even though, yes, this breathing is slower, it still does not need to be very deep. An attempt to take a very deep breath is actually likely to be counterproductive and end up in an over-breathing breath, where you're breathing out too much carbon dioxide and not, actually underutilizing the oxygen that you have. So having that oxygen get stuck in your bloodstream and not get to where it needs to go. For that reason, I don't recommend thinking about this as deep breaths, but rather, low and slow. So there's typically not a huge need to, get too much into the anatomy of this, although, I can talk about it a little bit. But the idea is just to shift the breath, from the chest to the belly, right? That's here we're going to be using the external intercostal muscles, which are the primary muscles for breathing. So this is why we're talking, this is often called the belly breath. You're not actually getting any air into your abdomen or into your stomach. You really shouldn't be. That's not the problem if that's what's happening. You're just using the muscles of the belly. And when you're using those muscles, that is what allows the ribs to expand and the diaphragm to move down. So the diaphragm kind of sits, right under your ribs. So if you feel where your ribs end, the diaphragm is kind of, there. And that muscle needs a little bit of room to move down on your inhalation. So this is why we recommend moving the breath from the chest to the belly. So that's the low part of low and slow breathing. And that will naturally deepen your breath. And then you're going to slow down your breathing to match the slight increase in the depth of the breath. In order for the breath to be healthy, we need a match between the depth and the rate of the breath. So because we're slowing down, we do need a slightly deeper breath, but there is no need to take a big deep breath, because that is likely to be too much. So the idea is just to allow yourself to take a sort of a normal size, for a belly breath. Breath in, thinking about this as if you're smelling a flower, always through the nose. Breathe in through the nose as if you're smelling a flower. So that's naturally going to be just a little bit deeper than typical, and it's going to allow you to slow down to your resonance frequency. And then for the exhalation, you can breathe out through the nose, or if it's harder to breathe out that slowly, you can breathe out through pursed lips as if you're blowing out a candle. right? And this kind of breath will allow the diaphragm to go back up. Your ribs will, get back to where they are typically. And the air will, the necessary amount of air will come out of your lungs. So we want the exhalation to be a bit longer than the inhalation. And that's about it.
So, I'm tall. So this might be a tall man question. I don't know. And I'm weirdly shaped. So take those two things into account. But my diaphragm, like I feel like I can breathe into my lower belly and almost like my lower ribs don't move at all. Is my goal to get lower ribs extended at all? Or is it if I just get belly out, I'm good? Because my belly is like, because I'm 6'7", everything in me is longer than most people. So like, I feel like I can breathe way down deep in there and my ribs don't do anything. Am I trying to get those lower ribs to extend out at all, or help me with this?
Well, so I'm gonna tell you, don't try here. Effort is likely to be counterproductive. I will also, so for the exact anatomy of this, I'm going to direct you to Dr. Dave.
Okay.
He will give you an excellent answer. But my answer is going to be really, don't try. Effort really will be counterproductive. You do want to be feeling the breath in the belly muscles. I suspect that your ribs are, coming out and doing what they need to. You're just not really feeling it. Yeah. When I breathe, I don't really feel my ribs coming out either. But I know that is what's happening. So don't try. Give your body a chance to do what it needs to do. For you and for other tall people, and another thing to keep in mind is you have pretty large lung capacity. As you said, everything in your body's bigger, so your lungs are bigger. You have larger lung capacity. So it might actually be easier for you to overbreathe because you can take a much larger breath in, but your oxygen needs are not all that much greater than regular height people. So just be cautious around that. So you really don't need big deep breaths because you can take a very large breath because your lungs can accommodate that. But then for your resonance frequency, even though your resonance frequency is lower, you are at 4. Am I correct?
4.5.
4.5, right? So you're definitely on the lower side. So you do have a little more time to exhale. But still, if you've taken in too much on the inhalation, even that longer exhalation, you're in danger of overbreathing. So don't be concerned with taking a deep breath. Just let the breath kind of go down to the belly, taking a normal size breath in, and just let the belly do its thing without effort. You're not really trying for anything here.
Awesome. So let's knock out a couple more easy questions, but ones we begin a lot. And I know we may have touched this on past podcasts, but it's been a while. We got a lot of people using the optimal zone. So let me again just keep throwing some softballs over the plate here. Does my resonance frequency ever change? Do I need to do the assessment over?
You should probably not. I'll tell you why I'm saying probably. So far, most of the evidence that we have says that resonance frequency really doesn't change. The only thing that resonance frequency depends on is your height, because it depends on the length of your blood vessels. So once you hit your final height, your resonance frequency should stay the same. Now, if we're talking about people who are still growing, I would redo a resonance frequency assessment once a year. Depend on the rate of growth, maybe even twice a year. But once you've hit your final height, it should remain stable because your height typically remains pretty stable. There was one study that showed that resonance frequency does change. There were some issues, with that study, and it's just one. So I'm not ready to say that your resonance frequency changes. I think at this point, most of the evidence points to the fact that we're likely once you determine your resonance frequency, as long as it's done accurately, you're good to go. But I am certainly leaving the possibility that we will learn more about this, and at some point the answer might change. But for now, I see no reason to redo it, as long as you feel like your assessment was accurate, that you felt comfortable, you were able to slow down your breathing, follow the pacer comfortably, etc.
I'm really trying to convince people that the 14 minutes they take the assessment may be the most important 14 minutes of their life. A little over dramatic, but I do think that is a point that in our onboarding process, I know you have people practice slow breathing before doing the assessment itself. So there could be, and I think we're maybe hitting this with a couple folks. You might, if you did it like just because you couldn't delay gratification and you wanted to get your resonance frequency rate right when you got the app, and then you do it 6 months later after you've been doing this, just because the practice, you may get a more accurate rate. So it might not, and correct me if I'm wrong, it may not hurt, especially if you jumped right in right away, to give it another shot, look at it later on. Might just see you've adapted to getting a better score, potentially.
That's possible. If you weren't entirely comfortable breathing slowly, if it's not clear whether you were able to follow the pacer, appropriately, or if you weren't able to sit still, if there was some artifact. The artifact is sort of the most problematic part here. Especially if you're using an app, with Optimal or any other app where, you don't have access to the raw data. Optimal does have pretty good artifacting. I'm actually quite proud of our artifacting. But, if there is a lot of artifact, it's still not going to be an accurate reading. So, if you were moving, if you're not sure if you were able to sit pretty still, definitely a good idea to redo. And again, if you weren't very comfortable with the breathing, good idea to redo once you know that you're totally comfortable breathing slowly now.
Awesome. Okay, so I want to dig a little deeper in the weeds here, but just this is not going to surprise you with the folks you work with. We got some competitive folks using the app, and I'm getting a lot of questions on how do I get my more time in optimal zone. I want to get more time in optimal zone. And one of those people might be me. And so like, I think my posture, I think my breathing, I think I'm getting those things pretty well in sync. I know I'm doing mine later at night, which I'm finding has lower scores than during the day, but just what is impacting our ability to get in and stay in optimal zone? Because on one hand, and I love your analogy of pushing the child on the swing, and resonance frequency breathing helps us really push at that optimal level where the child's going up and down and is happy. But if I do that at night, I find I get a lot more of a happy child or optimal zone green time than I do if I do it like in the morning. And I'm talking like maybe 85% in the morning to some really low numbers in the evening, and just kind of wondering how we should think about scores different times of day. We know like our RMSSD, if I have a hard workout, it'll be down, but is that the same for optimal zone? What is impacting these scores, and what may account for various scores throughout the days or on different days with folks?
Yeah, it's a good question. Well, for one thing, we definitely need a little more research on this. But I'll, give you my best ideas on this one. For one thing, trying and worrying about whether or not you're staying in the optimal zone is a good way to get kicked out of the optimal zone, right? Because if you think about what is the optimal zone indicating, it's telling you that your heart rate signal is in the coming primarily from the baroreflex and your parasympathetic nervous system. But, if your mind is in, oh my God, am I doing this right? And am I too tired? And is this the right time for it? And, what's my optimal zone score going to be? All of that rumination is associated with very low frequency power. So, even though your breathing might be, pretty close to where it needs to be, if your mind is in that ruminative state, you are going to get more very low frequency power and not as much low frequency, right? Your heart rate signal won't be concentrated exactly where it needs to be. Some of its input will be coming from the very low frequency. So your best bet for trying to get into the optimal zone is to give up to trying. I think we have a theme there is, do or do not. There is no try, right? We're
Right.
gonna adopt a, Yoda attitude here. Really, just letting yourself get into just letting your body breathe for you, letting your breath fall, into your resonance frequency rate, and just and observing the breath kind of in your mind's eye, just feeling, the inhalation, exhalation, just letting yourself feel that and disengaging from the thoughts that come into your mind, because these thoughts will come. Am I doing this right? What's my optimal zone saying? Etc. Giving yourself permission to let that go. It's okay for these thoughts to come, but you don't need to focus on them. Bringing your attention back to the inhalation, exhalation, and not the words inhalation, exhalation, but the actual feeling, just really feeling the breath. So a lot of it is about being in a more mindful state. But also, in the evening, if your nervous system is a little bit more dysregulated, it's harder to get into that low frequency range, which is why you are seeing higher scores in the morning and lower scores in the evening. But it doesn't mean that you shouldn't be doing your training in the evening. I might mix it up a little bit and do some of your training in the morning and some in the evening, but I think it's actually good to do this training in the evening to help your kind of more tired nervous system to regulate a little bit better. I would still be looking for your optimal zone scores to be going up, but only comparing evening to evening and morning to morning, right? If I would just assume that for you, you're going to be getting, for the time being, different scores in the morning and the evening. So, do your best not to compare those, because it will just stress you out. But you can look for improvement in your optimal zone over time during the evening. And there is also, the whole circadian rhythm. Your heart variability does vary based on a circadian rhythm, and which is why we take morning readings consistently, not evening readings, because morning readings are always different. So just keeping all of that in mind, and most importantly, giving yourself permission to just breathe, and other than putting yourself into a comfortable open posture, not worrying whether you're doing it right.
Yeah. So because it's interesting, I think what I've kind of, with our conversations, we are sort of pushing into new potential areas of knowledge, right? So really looking at low frequency in a very scientific way, while we can do it at different times or after or before, you kind of pre-post test different things. Not that that's the purpose of low frequency, but I think because on some of the reading that I do on low frequency, it's just like, if I can get my breath at resonance frequency, I should be in optimal zone. And I think even for me, that is sort of what I was assuming. As long as I don't watch TV and actually focus on the pacer, I should get there. And I'm finding that that's not the case. Obviously, if I'm not watching TV, my scores are much higher. I will give you that. But it's like I said, in the evening, I may still hit in the teens or low 20s. And I'm TV off, focused, kind of ticked off, but not really ticked off that I'm not in it more. But it's interesting to see that it just, my nervous system isn't there in the same way. I find it fascinating.
Yeah, and I think this is where we do need a little understanding. I would expect the breathing to be kind of the primary driver for getting into that low frequency state.
Yeah.
The fact that you're getting teens and 20s in the evening and like 80s in the morning is, I would say, a little unusual.
Well, it wouldn't be the first time that Matt scores a little unusual. So then at the end of the readings, I know we look at low frequency, and I love that I get my all-time low frequency to compare it to. and we get max min. I, I wonder, like, it doesn't happen often, but I know I'm not the only one that have gotten more time than average in optimal zone, and yet a low frequency score lower than my all-time average, and vice versa sometimes. So, max min, a little less of that, but I see that a little bit from time to time too. So those scores are connected, but they may show a little bit different things as we kind of get to that end page where we see our summary. But wonder if you could parse out that just a little bit about why those numbers might be a tad different than we'd expect everything to trend in one direction or the other.
Yeah. What's really important to remember here is the optimal zone is calculating the percentage of time that you are spending in that low frequency range. So it's the percentage of your overall power, during your training time that's concentrated in a low frequency range. But your total power is going to vary day to day. On the day when you're really tired, your total power is going to be lower.
Okay.
So your absolute power for low frequency is going to be lower too.
Interesting.
On
Okay.
a day when it's been a really great day and you're very well rested, and maybe it's still first part of the day, maybe it's not on the evening, right? So your body's regulating very well, and you're on vacation. Your overall your total power is going to be much higher. Your overall heart variability is going to be higher. So just the absolute power of low frequency is going to be higher because of that.
Fascinating.
So you might be in that really great state and your body is regulating very well, but you're doing your resonance frequency training while watching TV and not really paying attention to the pacer enough. So you might still have a higher absolute power of low frequency just by the virtue of there being more power in your HRV,
right?
But having a lower percentage because you weren't staying with your breathing pace the whole time. And on a day maybe when you are more tired but focusing better, your overall numbers, the absolute power is going to be lower, but you might be staying in the 90s because for your optimal zone, because it's just the percentage of what's there. But what's there might be, does vary day to day. And max min varies as well, right? Your max min is going to be higher on days when you're doing great. It's going to be lower on the days that are, where you're more tired or more challenged, etc. So just those do not necessarily go together. And the reason why we calculate the optimal zone as percentage and not absolute power is exactly because of that.
Right.
Because the absolute power will vary day to day, whereas your percentage depends less on what's going on that day and more on your breathing, except apparently for you, Matt.
So what you can also see, like, let's say you're doing a 20-minute session, the first 10 minutes you're on, and then the last 10 minutes, you see a call from somebody you don't want to see a call from. Shoot, you keep doing it, but we can also see shifts throughout the session as well, which I would imagine would throw off those scores in some way. Interesting way as well. So
yeah, absolutely. So being mindful does absolutely help. You want to stay with your breathing pace and be mindfully there, as opposed to thinking about that call that you got or something else, right? Because when we start ruminating, we really do see a change in the spectral display.
And so really, if people are competitive, not me, of course, but if other people are competitive and want to, like, we're so, like, maybe programmed of measuring our HRV and want it to be higher and higher and higher, and we're kind of in a little bit of that mindset in a loving kindness sort of way with the optimal zone. It sounds like a lot of the things that still could, like, improve our RMSSD scores, such as movement, sleep quality, it could still impact our optimal zone scores if that total power is down because of a lot of other a hard workout or something like that. We still may see end of the day versus beginning of the day. We still might see some of that overall improvements with overall health, overall decreases with activities and other things as well.
Absolutely. Yes.
Awesome.
And the long-term progress we're really going to see in those morning, morning readings, right?
Yeah.
This is where, all that training that you're doing, that those 20 minutes a
Paying
day
off.
practices that you're doing,
Yes.
right? You will see that pay off in a change in your morning readings, which is why it's so important to be taking those and not just doing the biofeedback training, because you will see the progress in it.
Right. Right. Because that's still our, I'm just calling our sacred baseline.
Exactly.
That's really why we're doing all this practice, is really to improve those morning readings. And if your optimal zone is higher or lower, I mean, it's data, but like, I know I sleep better if I do it before I go to bed. Like, so I'm gonna keep doing that like 10-minute practice before bed because I sleep so well, even though my scores are significantly lower. That it's okay, because that is that morning baseline that I'm still trying to work up over time.
Exactly. And, for a lot of the really competitive people, actually a part of what gives them the competitive edge is knowing when to let go of the go, 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 and try, right?
Yes.
So the resonance frequency practice is a great opportunity to let go and, let your breath breathe itself, right? Kind of falling into that resonance frequency pace, and letting your body do its thing and kind of getting out of the way,
Nice.
and that gives people a competitive edge, being able to move in and out of the competitiveness. So
Yeah.
there you go.
Well, and I find myself trying, well, if I breathe deeper, or if I exhale more aggressively or less aggressively and more peacefully, like you know the type. You've worked with us before, so I'm trying to like get in that green. I want that green. And basically, I mean, I'm doing it every day since I was testing it way before it was ever released. It is that kind of, I love that, letting your breath happen at that rate. Obviously you're manipulating it, but in a very just peaceful, rhythmic way, I think is beautiful way to put it.
You can create mindful change with your breathing, right?
Yes.
You can allow the breath, to follow the pace. Are you doing that mindfully? You're not struggling with the breath. You're not putting effort into it. You're not trying to make it happen. This really is the balance between, well, what mindful biofeedback is all about. It's that middle way, right? The balance between goal-directed action and letting go, right? And goal-directed action being, here's that pacer, and this is what we'd like our breath to do. And letting go is you let the breath fall into that pace and get out of the way and let it be, and you're not struggling, trying, etc. So it's a mindful change.
Love it. Any other things we haven't covered that maybe questions I haven't asked? Any other suggestions for folks as they embark on their HRV biofeedback journey?
Well, I would just to actually come back to something you said, to emphasize the importance of investing a little time into the resonance frequency breathing determination. It's 14 minutes, but it's really, for most of us, just once. Maybe you end up doing it twice. It's a fairly small investment, and we do have research showing that you get better results when you're breathing at your resonance frequency as opposed to being like 1 breath per minute off. So it seems like it's a very small investment, given that if you are dedicating 20 minutes a day to HRV training, you might as well be doing it in the most efficient way you possibly can.
Absolutely. Okay, so I got one Matt question for you. As our listeners are probably sick of hearing, I'm not tracking, so I'll put it out there, but just tell me if I'm wasting my time or not. I do something like Tai Chi slow movement activity. It's a Wing Chun set. I love it because I'm looking straight ahead, so I can breathe at the pacer while I do the movements to my inhale and exhale. I know there's no reason to track that because movements would create artifacts for the data. So I know that's not going to be any kind of measurable metric I can use. Am I still getting the benefit if I'm breathing at resonance frequency, whether it might be yoga or qigong? I know some folks do that. Like, as long as I'm focusing on the breath, does bringing my resonance frequency into that sort of practice? Am I doing something right, or should I just sit my butt down and breathe?
You're definitely doing something right. I would say there should be times when you should sit your butt down and breathe. There should be some
I
times.
did. Yeah.
But I don't think you're wasting your time at all. I'm not aware of any research looking at HRV specifically with Tai Chi. That would be a great study if anybody, is feeling motivated to do that. Or, maybe I'm not aware of one. But there are studies of yoga and looking at, HRV and yoga. And, there's, oftentimes gentle movement and slowing down the breath. So, all of that research, points me to say that I think what you're doing is absolutely beneficial. You may not be getting accurate recordings because of the movement, but I do think that you are stimulating your nervous system in a very positive way.
Well, me and Fred Schaefer have to sit down at a table and figure out his contraction research with my movement and rest. I think it's all there. We just got to put the pieces together, and then Ina, you and I can come up with our own new martial arts set. So
there you go.
the Khazan method. I like that. I think we go with that. So. Well, I really appreciate this. I know, after doing this for almost a year now since we've been testing it out, there's just been like little things that have popped up. And I know for a lot of our users now that are using this on a daily basis, we're just getting a lot of really great questions. And so I thought it'd be really worth the time. Again, whether you're using Optimal or any heart rate variability feedback app, just good to get the basics out there sometimes, because I think we get so excited about the new feature that sometimes we forget to ask some of those basic questions. So I really appreciate me just throwing softballs over your plate and you hitting them out of the park here. So I appreciate you, my friend. I can't wait to see you here in a few days.
See you soon, Matt.
And as always, you can find show notes and everything else at optimalhrv.com. Thank you for joining us today. And we will see you again next week. Thanks, everybody.